I want to talk a little bit about suicide. Now, I know it's not a happy topic, and it's not one that we talk a lot about, but it's an important topic, and I'll tell you why. Every year, on the average, in America, we have 30,000 suicides a year. 30,000 suicides a year in America. That's twice the number of homicides. And for every successful suicide, there are at least 8 failed attempts. And I say at least because many times failed suicide attempts don't get reported at all. So any kind of suicidal thought, talk, or behavior is to be taken seriously. So here are some things to look for, either in yourself or in those around you who may be struggling. Suicidal thought, talk, and behavior generally falls into 3 categories. The first one is called being actively suicidal. People that are actively suicidal generally have a plan and are able to articulate it. So they know what they want to do and they're able to tell you about it. In fact, they'll probably tell you about it. Something like, I'm going to take my car and I'm going to drive it off that bridge, something very specific. Those are the kind of people that are actively suicidal. Other people, though, are what is called passively suicidal. These are the people that have just basically given up on living. Someone who is passively suicidal just wouldn't do the things they need to do to continue to live, like they don't take their blood pressure medication, or they don't take their insulin if they're a diabetic. They just don't do the things needed to take care of themselves. They've just ceased to care about whether they live or die. And the third type of suicidal thought and behavior is called parasuicidal thought. Parasuicidal behavior. And someone who is parasuicidal will do things that are very dramatic, like wrist slashing and pill taking, that they know probably won't take their life. But you don't want to take that any less seriously, because what that is a very desperate cry for help. And there's no guarantee that 1, 2, or even 10 parasuicidal attempts won't ultimately result in a successful one. So any type of suicidal talk, thought, and behavior is to be taken very, very seriously. One of the great myths that we sometimes operate on when it comes to people who are struggling is that if someone talks about it, they won't do it. Nothing could be further from the truth. Almost all people who take their own lives give some indication and talk about it first. So keep your ears open. If someone around you is struggling deeply, suicide is something you want to watch out for.